my name is Zach. I am one of the nurse practitioner students. I'm going to be doing a quick head to toe exam on you. Can you please tell me your name and date of birth?
Hannah Knight, 11/05/1992.
All right, perfect. Hannah, I'm going to start off with the head to toe by examining your scalp. I'm looking for any sort of bumps, any bruises, looking for symmetry. Looks good. I'm just going to check your temporal pulse. All right, that looks good. All right, next thing, I'm going to end up checking a couple of cranial nerves. Can you raise your eyebrows for me? All right, perfect. Can you close your eyes real tight? Perfect, you can open. Can you give me a smile with teeth? Now give me a frown. Can you puff out your cheeks, please? All right, perfect. Now give me a good shrug. Awesome, perfect. I'm gonna end up feeling your joint right here. Can you open and close your jaw a couple times? All right, good. No pain or discomfort?
No.
All right, great. All right, next thing is I'm gonna end up using a little cotton wisp. I'm gonna touch parts of your face with your eyes closed. You just let me know whenever you're feeling that, okay? Eyes closed?
No. 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 No.
All right, good, you can open up your eyes. All right, perfect. Next thing, I'm gonna end up checking the outer structures of your eyes. I'm just gonna lower your eyelids right here. Can you look up for me? Perfect. Can you look down for me? Can you look left? Can you look right? Looking at your subconjunctiva, your eyelashes, and your eyelid, eyebrows look good. Perfect. Next thing is I'm gonna end up actually having you watch my finger with just your eyes and not your head. Perfect. All right, keep on watching. Perfect. All right. Next part of this is I'm gonna end up dimming the lights. And I'm just gonna have you focus on a spot behind me, and I'm gonna flash a bright light in your eyes a couple of times. I apologize ahead of time. Constriction and opposite. Looks good. All right. Good. And the other one does as well. All right, perfect. And I'm just gonna take a big, closer look at your eye. All right, got red light reflex, a little bit closer. All right, you got disc and cup more medially, and fovea and amicula more laterally. Looks good. All right, red light reflex, disc and cup more medially, fovea and amicula more laterally. All right, looks good. Perfect, thank you. Sorry about the bright light. All right, next part is I'm gonna just check your ears. Next part, I'm gonna end up checking for symmetry of your ears. Oops, sorry about that if I gave you a chill. All right, any recent hearing loss or any pain in your ears? All right, good. I'm gonna do a quick little hearing check. I'm gonna whisper 3 words. After each word, just repeat back what I said, all right? Dog.
Dog.
Cat.
Cat.
Blue.
Blue.
All right. Red.
Red.
Green.
Green.
House.
House.
Perfect. All right. Next, I'm gonna just check inside of your ears. I'm gonna have to pull on your ear a little bit. Looking forward. All right. Membrane looks intact. And no excessive cerumen. Perfect. Sorry. All right. Membrane looks intact and no excessive cerumen. All right, looks good. All right, perfect. All right, next I'm gonna end up checking your nose. Quick little patency check. Can you take a breath through your nose for me? Perfect. Another one. Perfect. Just gonna check your nose. I'm gonna have you tilt your head back a little bit. All right. Turbinates look good. No polyps. All right, the other side. Turbinates look good. No polyps. All right, perfect. next I'm gonna end up checking your mouth. I'll have you open up your mouth. I'm just gonna be flashing the light, checking your looking at your cheeks, your gums, your buccal mucosa, your hard palate, your soft palate, your tongue. Can you lift up your tongue? Thank you. Looking for any lesions. Looks good. All right, next I'm gonna tell you to say ah. I'm gonna end up gagging you, just checking. All right. All right, perfect. That works great. All right. Just gonna take a look at your neck right here. Trachea looks midline. That looks good. No goiter noted. All right, I'm just gonna be checking some lymph nodes here. Pre-auricular, post-auricular, posterior occipital, posterior cervical, to supraclavicular, sorry, to submental, to submandibular, to anterior cervical. All right, perfect. And no Virchow's node is noted. That looks good. All right, next part is I'm gonna end up checking your thyroid. I'm gonna be behind you doing a posterior approach. I'm gonna have you take a sip of water, and after each sip, hold it in, and then I'm gonna have you tilt your head down to your chest and tilt it to one way, okay? All right. All right, take a sip. All right, right here, midline. All right, head down and tilt to the left. All right, swallow. All right, feels good. All right. Midline. All right, head down and tilt to the right. Swallow. Perfect. Thank you very much. Thank you. All right, for the next part, I'm gonna end up checking your lungs. I'm just gonna be taking a look at your chest right now. I don't see any sort of bumps or bruises. Your AP diameter looks about 2 to 1, which is normal. All right, I'm gonna end up doing some percussing. All right. All right, perfect. Turn me back. Perfect. Looks good. All right, I'm just gonna take a listen. After every time that my stethoscope moves, please take another breath. All right. Just breathe in. All right, and the back side. All right, perfect. All right. Next, I'm just gonna feel your carotid here for a second. That's good. That feels good. All right, perfect. I'm gonna just take a listen there, and I'm gonna have you take a breath and hold in for a second. Okay.
Mm-hmm.
Take a breath in. same thing. Perfect. All right. Just gonna take a listen to, I'm gonna have you lean forward for me a second. I'm right now looking for any sort of pulsations or any heaves in the chest. All right, you can lean back down. I don't see any. I'm gonna take a listen with both the bell and the diaphragm to listen to certain areas of the heart. All right. Sorry. Perfect. Can I have you lay down, and I'm going to do the same exact exam. Let's go and start about the stethoscope. One last time. While you're laying down, I'm gonna inspect your abdomen. Right now, I'm just gonna expose a little bit right here. Perfect. All right, I'm looking for any sort of bumps, bruises, any scarring. That looks fine. All right, I'm just gonna take a listen to your abdomen. Percuss right on your belly for a second. I'm just gonna feel percuss for your liver border. Alright, right there. I'm gonna have you take a deep breath, and I'm gonna press down a little bit here. Alright. And exhale. Thank you. Just gonna feel around for the rest of your abdomen. All right, that looks so good. You can lay on. Actually, yep, while you're done. Thank you. All right, and next I'm just gonna check some of your pulses and a little bit of your vasculature. Right now, right now you feel very warm. You feel very warm. Checking your capillary refill. Looks good. Looks good. Checking your brachial pulse. Feels good. Checking your radial. Perfect. All right, gonna check your femoral. Perfect. I'm gonna just check the rest of your leg for warmth. Check the capillary refill. All right, looks good. All right, checking for any sort of edema. Checking for capillary refill. All right, that looks good. With the leg still up, I'm gonna check your popliteal pulse right behind your knee. Right. In PT. that leg and this leg up. PT. Looks pretty good. Alright, I'm gonna have you lean back up. Forward, please. Next part is I'm gonna end up using that same cotton wisp, and I'm gonna have you close your eyes again, and I'm gonna touch parts of your hands and your legs, and you just let me know whenever you feel it again. Okay? Eyes closed.
Now. 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 Now.
Perfect. You can open up your eyes. Thank you. Next, I'm just going to check some deep tendon reflexes. All right. And I'm going to check the tricep first. All right. Perfect. And the other side. Perfect. I'm gonna check brachial, or your bicep. Alright, looks good. Perfect. Your radial, just go up here. Perfect. All right, next part is I'm gonna have you end up having your arms here, lock your arms real tight, and on the count of 3, just keep on pulling. I'm gonna check your patella. 1, 2, 3, pull, pull, pull. Perfect. 1, 2, 3, pull, pull, pull. Perfect. And you're done with that. All right, I'm just gonna, one last one, I'm gonna check your Achilles. Perfect. All right, one more here. Perfect. And while it's here, I'm going to check your Babinski reflex. Perfect. A little ticklish. And one more. Check your Babinski. Perfect. All right. One last thing is I'm going to end up having you stand up. I'm going to have you look this way. And I'm gonna have you have your hands forward as if you're diving into a pool and touch your toes. I'm checking your spine right now and it looks very good. Or you can lean back up. All right, back up. And hands on your hips. I'm gonna have you rotate one way, rotate the other way. All right, that looks good. Now rotate a little to the left, and a little bit to the right. All right, everything looks good. Thank you very much for your time.
You're welcome.
Thank you.
Don't ever